I'm going to get started because I think we have a really, really
Hola.
exciting webinar. And I always do my bit at the beginning, which a lot of you already heard. If you're here for the first time, this is my face. My name is Andrea. I'm a vet as well, and I have founded UniVets Global a few years ago with the goal to train vets in specific hands-on clinical skills. So we teach those skills that require your body to do something, not just your brain. And our goal is very simple. This was something that I noticed when I was working that we didn't, one of the reasons for us to struggle with the job was that we didn't feel like we could do these skills and we weren't confident with that and we were worried about making mistakes, which is one of the things we're really going to be talking about today. And the goal is to help vets overcome that so you can actually do things that you like and not feel nervous about the things that you need to do or should be doing. This is a very quick overview of how we developed this method, which is developed to make you actually learn those skills. Because we're not talking about just something that you need to know from in your brain. It's something that you need to do. We focus really, really, really heavily on that because that's what I felt was missing from everything that I looked at. Like when I learned some ultrasound, I did two ultrasounds, and you cannot learn how to do an ultrasound on your own by doing two ultrasounds. So we focus on providing a lot of hands-on experience, but at the same time, we give the background knowledge for that to happen, but also we make sure that when you are learning, you're having a good time. So this is important for us that when people are with us, it's not just hard work. There's also fun and joy involved in learning. And of course, then it doesn't just stop there. So we make sure that you have a follow-up for your development. It's not just come over, here's this, learn how to do ultrasound, go away, and good luck. No, we provide ongoing support as well. And our very first training was on neutering. This is related to the fact that it was a skill that was very necessary for me when I was working. So I am from Portugal, but I moved to the UK and I was working in the UK. And in the UK, you had to be a generalist. So you had to know how to neuter. And it was one of the issues that overseas vets had. It was that when we moved to the UK, we usually were quite good at handling cases and we could see all the appointments and we could deal with cases coming in, but we did not know how to do surgery. And that's how it all started. From then on, we moved on to other skills that are also really good, really useful for clinical practice, and that really help you looking after your patients better. So we started to focus on ultrasound, which is a very underrated skill, and it is not that hard to learn. We can make people learn this skill really quickly in 5 days. You can learn how to do an abdominal ultrasound on your own in 5 days. I promise you that. If someone tells you otherwise, come talk to me because I can prove them wrong. And then we've also focused on echocardiography, which is a little bit more specific, but it's one of those very frustrating things, which I've heard people a lot of times coming to our course. And one of the things that they said was that they were doing some sort of cardiology post-graduation or imaging post-graduation, and they knew how to interpret an echocardiography, they knew what to look for, but they did not know how to actually do the echocardiography. So they couldn't get those images. So that was one of the reasons why we developed that specific training. And those are actually part of our news. So we've now, this year, we're going to do a very, very, very small one-to-one echocardiography training in Scotland. So this is going to be only 3 people taking this course, and it is a mixture of practicals, so doing echocardiography and learning echocardiography techniques, but also discussing cases and working on cardiology. So this is going to take place in October. This is not available on website because it's very exclusive. It's only for 3 people. We already have one person signed up. So we are just basically telling people about it and going through word of mouth. That's how you say it. And I sent an email, you may have received it. I sent an email not long ago about whether people were interested on doing some advanced ultrasound as well. So abdominal ultrasound, but also ocular ultrasound. And this was, I got a lot of replies. So we are definitely going to look into doing something like this. If you are interested, because there is not on the website, what we are doing is we're taking note of the people who said they are interested in this or they want more information. So just you send me an email. So we make a list of people who said they're interested and they want to keep track of things. And then when we have a little bit more information, such as what we're going to do on each day, the exact dates and the exact place, we will email you. And this is why I put my email here. You will see the email again because at the end of this webinar, you will have this for your certificates. Actually, it's maybe not this, so you can keep my email, but I'll put it on the chat as well if you guys want. For today's session, now that we are quite a few more, if you've not been here before, what's happening is that everyone here is muted. So only me and Cristina are able to speak. I will shut up though, so I will mute myself when Cristina is doing her presentation and her session. What we want you guys to do is we want you guys to use the chat function to put your questions or anything that you guys want to discuss. We also have a few interactive cases for you. So if you put your questions and your comments on the chat, we will go through them. During the interactive sessions, we will go through the answers, and then at the end, we will go through the questions that you guys may have. And what we will also do is at the end of the webinar, there is the QR code for the 1CPD app for vets who are in the UK. If you're not in the UK, you'll have the email where you can ask for the certificate of attendance. And for now, we are going to get started. So over here, I have Dr. Cristina, and I think Hillary may have been able to join as well. So I think she's also here.
Yes.
I did end up making it. Yeah, thank you.
Hello.
Yeah, which is great. So Dr. Cristina is going to be doing most of the session tonight, and she's a GP. She is a vet.
Yes.
With a lot of experience, but also very, very passionate about education, about soft skills, about communication. And Cristina and Hillary put together a company called From Hello to Healing, which you can find on Instagram, guys. It's here, Hello to Healing Vets on Instagram. There's also a website which you can find through the Instagram profile. And you'll see that they are doing a lot of work in terms of workshops with communication, but also working with new grads. So, Cristina, now is your turn. I'm going to stop sharing my screen.
Yes,
so I think yours.
Yes, I'm going to start sharing mine.
Exactly. And
There we are. Can you all see it?
Yes, we can. So I'm going to zip up. But I'll keep an eye on everything and I'll look after all the tech stuff.
Sure,
and,
thank you.
Yeah, and I'll be reading through the chat for you as well.
Thank you so much. So I just want to very briefly introduce myself. As Andrea said, I am a very proud GP vet, which means general practitioner, not a specialist, even though the European Board of Veterinary Specialization is planning to put primary care as a specialty, as a residency. So I'm looking into that, who knows? But at the moment, yeah, I am proud to be a general practitioner vet. I started my career in the UK. I actually worked over there for 9 years. Now I am back to Italy. I work in the north of Italy in Parma in a 24-hour hospital where I mainly deal with primary care but everything else as well. So primary care means surgery, as Andrea was saying, spaying, neutering, but not only, lamp removals, emergencies, and especially caring for our pets and their clients. And that's why I am particularly passionate about communication, which sounds always like a very boring subject, I think is something, so important to do our job the best we can. So with Hilary, with my colleague, we found this little company. So we are traveling Europe. We are going in several faculties, where we do little workshops, mainly about communication, but also with some clinical skills. So tonight, I am super happy to talk with you about something that I think is a very, very important subject, and something that we all will come across at a certain time, at a certain point, unfortunately, which are mistakes and how we can deal with them from the communication, side of things, point of view. So we actually start with the little, interactive section of my presentation. So I have this photo for all of you to look at. I would say about 2 months ago now, a part of my job is to look after new grads in my hospital. So I'm super happy to teach them, spaying, neutering between other surgeries. So this is what I came across a couple of months ago. My new grad was doing a cat spay. And then she called me. What for? What do you think these are, guys? If any of you wants, to put their thoughts in the chat. What are we looking at in this picture? Ovary, yeah? We all agree? Do we all agree? Any other thoughts? Oh, well done. Well done, Mohammed. Yeah, I think it says, I think one is not an ovary. Testicles, they are gonads, but one of them is a gonad. Right. So what we are seeing on the left side of the screen. Yeah. Well done, guys. Not quite one. So one of you is answering one ovary and one fat segment. Close. So on the left side of the screen, we can see an ovary indeed of a cat. But on the right side of the screen, as some of you have spotted, we are not really looking at an ovary, but at a mesenteric lymph node. So this was the situation in theater. So as you can see, we are now looking at loops of small intestine. And on the left side of the screen, we can see that big hole, right? In the mesenteric ligament. So what happened here is that when my new grad, while performing a cat spay, she indeed removed one ovary, but then she somehow managed to do a perfect lymphadenectomy, which is impressive, to be fair. So, well done her. So she, unfortunately, by mistake, managed to remove what she thought was the ovary of the cat, but was actually a lymph node of the mesenter. Too much air in operating field. Yeah. Good point as well. I think we could have done better as well with the clipping of the animal. Yeah, good comment. So she managed to remove the lymph node. So obviously this was unfortunately a mistake. We can maybe at the end of the presentation chat about what you would have done in this case clinically, which is very interesting. But what I am going to talk to you about tonight is also how to handle this sort of very scary situation from the communication point of view. So mistake and complications. First of all, they are unavoidable and we will all experience them. We don't want to, of course, and we will try our best to avoid them. So we study hard, we try to improve our clinical skills at all times, but in our job, unfortunately, all of us at a certain point will experience these mistakes. And what happens when mistakes, happen? So, well, studies in human medicine, like this one from 2003, show us that patients who are victims of medical errors experience a lot of feelings, such as sadness, anxiety, anger, and frustration. And of course, our clients, so the caregivers of our animals, will feel the same way. And mind, not easy to deal with all these emotions, as we all well know, or soon we will all know. Some definitions, first of all. In our job, we can look at near miss, which are about 40% of these mistakes. What is a near miss? It is a mistake that does not reach the patient, such as, for example, so we are making an analgesia plan for a patient, for example, for a post-op spay, a patient, a dog. So we ask our nurse to draw up buprenorphine, and we ask her to draw up 20 micrograms per kilo. And maybe she draws up 20 milligrams per kilo. But then, well, luckily, we have a look at the syringe. We see that the volume is too big, and we recheck. So that was a mistake, but luckily we spotted it before that medication was injected. And then we have an armless sit, which is about 45% of the percentage of mistakes that can happen in veterinary practice. What is that? The armless hit is, for example, a wrong dosage of, again, buprenorphine, which is actually injected to the patient, but luckily it ends just with, for example, some cardiorespiratory depression or some heavy sedation, but that does not cause harm in the long term for our patient. And finally, we have proper adverse event, which luckily is the smallest percentage of these, big pool of mistakes. Those are mistakes who reach the patient and cause harm, perhaps even long term, such as, for example, an overdose of a non-steroidal medication, for example, an overdose of meloxicam in a cat, which can cause kidney disease. So this slide is just somehow to reassure you that the vast majority of mistakes that happen in practice do not eventually harm the patient, which is, something to keep in mind and to be a little bit reassured about. What about studies in vet practice? So these are two recent studies that came out. So in a survey of 606 vets, 74% of them have admitted to having been involved with at least one adverse event or a near miss in the preceding 12 months. I am telling you more, myself, me, a 11 years out vet, I had a near miss last weekend. So a dog came in with, scratching the ear, shaking the head. So the owner thought there was a grass awn, a grass seed in the ear. So the dog was not very compliant, the patient was not very compliant, so I had to sedate the patient. So patient was sedated. I was super busy with lots of consults, as how it generally happens with our job. And I checked, the ear of this patient, and I didn't see any grass seed. So, but there was a little bit of earwax. So I was thinking, oh, this is just, a simple otitis. I was already reaching, for some eardrops to send the dog home with. Luckily, my nurse was with me, and she was like, oh, can I have a look as well? Mainly, to check the ear anatomy in a sedated patient. And when my nurse had a look, she was like, Cristina, but I think I can see something greenish in this ear, but isn't that a grass seed? And they was like, no, I don't think so. I mean, I checked, thoroughly. I don't think there is any grass seed. And she was like, I can see something. And it was like, well, I mean, have a go, try and see. And she took out a grass seed, which I missed, probably because I was looking at the air, just too quickly, thinking about something else. So, that percentage, 74% of vets who have been involved in an adverse event or near miss in the preceding 12 months may even be bigger. and the one I told you is just a little example. And also in this other study, looking at animal teaching or private hospitals that are looking at statistically wise about 5 medical errors every 1,000 patient visits, which is a 0.5%. So again, they happens, mistake happens. And they happen to our human colleagues, human medicine colleagues too. And I actually was quite surprised when I was, preparing this presentation for you guys to find out that about 1 out of 10 patients in hospital in developed countries, so, Western countries, fall victim to medical mistakes, and up to 1 out of 300 patients can die, because of these medical mistakes, which is such a, shocking statistic. And also in human medicine, mistakes include, commonest mistakes are drugs administered too early or too late, or via the wrong route, or wrong medication, or wrong dosages. And these are very common mistakes that can happen to us as well. So we learned so far that mistakes happen. They happen to vets, they happen to human doctor, they happen to Cristina as well, and they happen in the past, and they are happening, sadly, even now, 11 years out. Now, how can we handle them the best way we can with clinical communication? So, when veterinary clients learn of an error or a mistake that has happened, they may experience 2 different types of disappointments. Of course, one is disappointed with the error, and we cannot do anything about that. We cannot control their emotions. We cannot control their sadness, their frustration, their anger. We cannot do anything about that. We can manage it, and we will see how in a second, but mistake is done. We cannot do anything about it. But we can do a lot with the handling of the error. So with how we deal with the situation. And indeed, let's remember that clients tend to be less forgiving of mistakes in the handling of the situation. Indeed, because the mistake is done, we cannot change, unfortunately, the past, but we can handle it, handle the communication, as we are going to see tonight. Again, we cannot change the facts, but we can influence how the event is managed. So before going deeper into this, I would like to make you think about this. So are conflicts with clients or mistakes, errors always negative? Because we give negative meaning towards such as a conflict or death indeed, or errors, but most of the times these events can be opportunities to learn how to do better, opportunities to be a leader for our clients in dealing with their emotions and with the situation. And indeed, growth and development would not exist in a system without conflicts. So just, a positive thought before getting deeper into the matter. And also, I really like this little picture I found for you that says, is not as big and scary as it feels in your head. Why did I bring this little, picture for you? Because I remember the first times when I had to pick up the phone and call a client in a different language. I was working in the UK, as I said, as a new grad. So obviously English is not my native language, as you can tell from my pronunciation. So I remember still nowadays those moments when I had to pick up the phone and perhaps tell the owner about a pet who came in an emergency and died. I remember particularly a guinea pig, one day that died shortly after the admission. And before picking that phone up, in my head, I was terrified. But I'm gonna tell you something. Always, 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 all those phone calls eventually have been way less scary than what I was picturing in my head. So clients know that we as veterinary professionals are human beings like themselves. So let's remember, they know we are not robots. So they know we can make mistakes. And the key is that when they see that we deeply care about their pets, about what happened, about trying to make things better, they will be more understanding and forgiving. So let's see how practically we can show them the, our good intention in order to lower the chance of having a complaint. So let's remember that, and this is, a principle that is important in communication in general. Let's remember that clients, first of all, wants to be heard. They want to be heard and understood. Another very important thing is that that we will see clients are willing to see that from that negative event, something good will arise, so that, for example, positive changes of procedures will be implemented. And I will give you some examples. Also, they desire genuine reasons, if we know those reasons, and explanations as well of what happened. So very important to be transparent. I learned this, and this actually works, to be transparent with clients is the way to gain their trust, even when mistakes happen. And, sometimes I was a bit shocked when I came back to Italy to work, because in the UK, they teach you to be as transparent as possible, also in these situations. For example, there is a company called Veterinary Defense Society, which is great. It's like a liability insurance for vets. And the course, they make courses about handling, mistakes. And transparency is always one of the pillar, the pillar in the communication. When I came back to Italy, it wasn't, quite like that. Like the general culture is sometimes, to actually try and hide mistakes, which always, troubles come from that. So I think transparency is so important. But we can discuss this at the end of the presentation, perhaps with some of your thoughts as well. And when communication is effective, clients will happily return and entrust their pet to the care of the clinician again. Give you an example of another of one of my mistakes. So I would say about maybe less than a year ago, I do dental procedure as well as part of me being a general practitioner. And I did a scale and polish with some extractions in a, what's the name? Not bloodhound, but similar to a bloodhound. Basset hound. in a basset hound. So did scale and polish, and I had to do multiple extractions, between which there was also the carnassial tooth. So one of the upper molars. So I did the extraction. The mouth was very, very dirty, was very bad. So I decided in that site of extraction of the carnassial not to put stitches, okay? So anyways, the dog, then woke up, and the appointment for the clients to pick up the dog was at 3 p.m. And it was probably something like maybe 2:45 or something like that. A nurse approached me. And, my nurses really like me because I am fun to work with, I suppose. So, they always approach me with a lot of respect. So my nurse was like, hey, Cristina, I think, your patient, I can't remember, Guachipupa was her name. I think Guachipupa is bleeding a bit. And in my head, thought, oh, well, yeah, usual little bleeding, post-extraction, maybe with the saliva. And so I was like, well, yeah, I did some extractions. It's okay if there is a bit of blood. And my nurse was like, no, Cristina, I think you should come and have a look because she's bleeding. Anyways, went to the kennel, and what I saw was a dog with a pool of blood in front of her. So I was like, right, this is not a normal bleeding. Anyways, to cut the story short, I had to go back to theater. But of course, the client, arrived like 5 minutes later because they had the appointment to pick their dog up. So I somehow managed to talk to them in a way, to be transparent. I told them, look, I must have hit a blood vessel. I didn't put stitches when I was in theater because the mouth was very, very, there was a lot of infection. I was worried to block some bacteria with my stitches, to block some bacteria inside, for an abscess to come up. I mean, I managed to explain them what happened, explain to them that I would now have to go back to theater with Guachipupa, to put some stitches, but that I was very positive that everything would end up well. And I told them, look, let's plan a pickup later this evening for Guachipupa at 8 p.m. when I'm sure that everything is okay and is under control. Anyways, I must have spoken to them in a way that I am now their favorite vet. So I thought they would never come back to me again. But actually, they booked their other dog with me for a dental, and they always ask about me when they come in for any visit. So again, I think communication is actually more important than our clinical skills, sadly, because of course, learning about communication is more boring than learning about, about cardiology, but is as important, if not more important. And what is our best communication skill, the most important that we can use when dealing with mistakes, is empathy. What does that mean? So we should show our clients that we are sorry about what has happened, and we should show them that we understand how they feel. So, for example, if a client comes back in and, for example, the clients of Guachipupa, they were quite shocked because they thought they were there to pick up their dog, but their dog was back to theater because of a bleeding. So they were shocked. They were worried. So the way to show them empathy is to literally tell them, I can see you are very worried right now, and I understand why, but believe me, Guachipupa is in the safe hands of my anesthetist. I'm going back to theater. We are going to stop the bleeding with a sponge, and then I'm going to put stitches. She will be okay. We are going to give her extra pain relief, and so on and so on. So we perceive the client's, emotions, and we tell them what we see, so that we see that they're worried and that they are right to be worried, but we have the situation under control. And this is what will happen with their pet and how we are dealing with that situation. Also, when we are transparent about mistakes, this is not an admission of medical negligence, because, I mean, we never make mistakes because we want to do harm to our patients, obviously. For example, I didn't put stitches in that extraction because the mouth was so infected that at that time I reckoned that putting stitches could have caused an abscess. However, what I told them is that from then on, I will actually, after an extraction, I will actually try to clean better the extraction site surgically and then put stitches to try and avoid similar bleeding in another patient. So being transparent is not an admission of guilt, but rather a way to create a connection with the client, which indeed is the start of the conflict resolution. Some examples of empathetic language, it could be we could say something like, this must be difficult for you. So we acknowledge their feelings. And this is a way to de-escalate situations. So in difficult situations, as we saw at the beginning, there are a lot of fire feelings from the clients. So anger, anxiety, frustrations. Some clients can become very nervous. So techniques to de-escalate the situation is to acknowledge their feelings. So phrases, sentences such as, this must be difficult for you. Also, we can elicit the client's perspective with sentences such as, what do you think would help you navigate this situation? How can I help you work through this? Or also, maybe, this was not the case for Huachipupa clients, but for example, if something happens and the dog needs to be brought back to theater, maybe the client is also nervous or angry because of the cost, that may be associated with this complication. So something that we can say is that I can see you're worried about the cost involved with this situation, but I will ask my clinical director if we can cover part of the cost, or I will ask my clinical director if we can do installment payment, and actually doing that, and talking to our boss about ways we can help the client with costs as well. A situation will de-escalate if we ask permission, for example, especially, if something really bad happens, such as the death of a pet. We can say something like, may I share with you what I know about what happened so far to your pet? And again, reflective listening, which means we listen to our clients first because they want to be heard. And then we paraphrase what they've just said. For example, what I'm hearing you say is that, or I want to make sure I understand what you have told me. So these techniques help massively in calming down the situation, because what an angry client wants, to obtain, first of all, is to be listened at. Again, sometimes, unfortunately, the pet has died. For example, that guinea pigs, I had once, died shortly before admission. And sometimes we do not know why. And we can say that. We can say something like, there are a lot of unknowns right now. I have a lot of questions myself. But if it would be of any help for you to navigate this situation, we could perform necroscopy. for example. There is always a way to help our clients, even in those, extreme circumstances. Again, we should objectively describe what, how, and why the complication happened, as I did, with that dog, Guachipupa, and their owners. And also we should, when we discuss, complication with the clients, give them the time to ask us questions. However, still trying to lead the conversation in a smart way for ourselves. So we should share the details we know in order perhaps to have less difficult questions, from the client side. And the key, which I mentioned at the beginning, is to reassure clients that we learn from this mistake and that this gives us the opportunity to avoid similar mistakes to other patients in the future. I have an example for this one as well. I made a lot of mistakes during these 11 years of practice. So these mistakes, goes back to my first years in practice. I was still in Wales. And unfortunately, I ended up overdosing a cat with meloxicam, a post-op of spay cat. I overdosed with meloxicam, and this cat unfortunately went into kidney failure. So at the time, I remember, obviously my boss at the time helped me dealing with this situation. We even called Boehringer Ingelheim, which is, the drug company that makes meloxicam. This was a very difficult situation to communicate to the owner because obviously, that was a young cat, young healthy cat that was coming in for spay. And the way my boss, dealt with this situation was to offer free of charge hospitalization for fluids, misoprostol, and supportive care for this cat who ended up having kidney failure. We even called, as I said, the drug company. Unfortunately, eventually this cat passed away for acute kidney failure. So was a very, very hard, situation for me to navigate. But the client didn't put any complaint in because of how well my boss managed to deal with this situation. And one of the things he said to the owner, when there was the meeting, obviously with the owner after what happened, is that he reassured her that from now on, the pre-anesthetic blood test, to check for underlying, for example, kidney issues, would have been reduced in cost so that more clients could, go for a pre-op blood test, because that cat didn't have any pre-op blood test, and the drug company suggested that there may have been an underlying kidney issue because this cat did not respond at all to supportive treatment and unfortunately died. So to reassure the client that after what happened, a change is made in the protocols of the clinic to avoid similar events in the future is very, very, very important. And something else, before starting difficult conversation, let's think about this, that many people do not hear what they are told because they keep listening to what they are about to say. And this is a nice photo as well, I think. Sorry, I forgot your name. I was too busy practicing saying my own name in my head, which is something that happens to me at all times. Whenever I introduce, or somebody introduces me to somebody else, I immediately forgot their name because I am too focused on what I am about to say. And in difficult conversation, this becomes very true as well. So We should prepare our conversation before, as we will see in a second, maybe discussing this with more experienced colleagues. So discussing what we will say to the owner. However, the first thing when we are having a difficult conversation is to let the owner talk and listen. And another thing we should think about before starting a difficult conversation is also about the Marlowe pyramid. I don't know if you ever heard of that. This pyramid says that before doing something complex for our brain, such as dealing with a difficult conversation, we should first make sure that our basic needs are met. And I'm telling you this to you because you're vets or you're going to become vets very soon. And as vets, we forget to drink water, we forget to pee, we forget to eat, and so on, because we're always so busy and we are so dedicated. We are dedicated people, to our jobs. But, difficult conversation is the same as doing a TICA, it's the same as doing a difficult surgery. So first of all, before starting, let's make sure that we drink a bit of water, or we ate a whole packet of snacks. So I would be the one eating a whole packet of snacks. But you can drink some water. It's healthier. And then again, what should we do? Keep calm. Go in a private and protected place with the client. Of course, not in the waiting room. Better to go in a separate, quiet room. First of all, listen and encourage the client to talk. Empathy. We could take notes as well to show the clients that we are fully focused, on the matter and on what they are telling us. Summarize or paraphrase, as we were saying before, what the client has said, to let them understand that we are actively listening and understanding. And again, ask if you understood everything correctly. Another, practical example, for example, this one says that after struggling to retrieve the ovaries during a cat spay, as you see, most of these examples are about spaying. So spay, neuter, dentals, so things that we do a lot in general practice, because the more we do about something, of course, the more we risk, to end up with mistakes. So in this case, we were struggling to find the ovaries in this cat. We realized that this cat was not a female cat, but was actually a male neuter cat, tabby cat, same looking cat that was in the hospital for something completely different. So this is a big, big mistake. And I've seen similar mistakes happening in trying and spaying a male cat. I don't know if you ever experienced that, but this is a pretty common mistake. So what should we do? Breathe, drink, center ourselves, calm our initial reaction. And then as soon as possible, we should advise our bosses and a professional liability insurance. If there is any, we don't have it in Italy, unfortunately. I hope in Portugal you have it. Maybe we discuss that at the end of the presentation. And especially ask for support from senior colleagues. Sometimes you are in sole charge, but even if you are in sole charge, remember, as a vet, you are not in a bubble. You have networking from uni, colleagues from uni, you have Andrea, you have me, there are senior vets. It's very important that you share what happened, so that we can help, senior vets can help younger vets in figuring out the situation. And then take a little time to review and mentally rehearse how you will communicate with the client. And then we have to take that first step, pick up that phone or invite the client to a private setting. Again, we apologize early, empathize often, check in with the client as we've seen before, make quick notes. These will be also very important, you know, when you make a mistake or a complication happens, immediately, even before seeing the client, note down everything, you know, a TPR, the drug, what happened, because this is very important also in case, you know, a complaint then comes in, so that you have all the facts recorded. And then provide a warning shot. What does that mean? For example, on the phone, when I had to deliver bad news on the phone, a warning shot could be something like, good morning, Mrs. Smith. Is this a good time to talk? And the warning shot can be your voice tone. For example, I'm always very bubbly when I talk, but of course, I have a very low voice tone when something bad happens. So, good morning, Mrs. Smith. Is this a good time to talk? Unfortunately, I have bad news, you know, something like that. And then disclose the information about the error, what happened, why it happened, take responsibility, apologize, empathize, express remorse that you are sorry that that happened to that patient. Explain the implication of the error for the patient. What does that mean? Very important. So this has happened. So Huachipupa is bleeding from her extraction site, but she's now in safe hands. We are inducing anesthesia again. We are taking her to theater, and then explain what will happen. And as we saw, address how future errors will be prevented. So we are going towards the end of our presentations, but there are still some important, very important messages I want to give you. Who are the victims of the mistakes? There is more than one victim. The pets, of course, bless them, our patients, the clients, the practice, because of the reputation perhaps, but especially the clinician. So I found out that the biggest victim of my mistakes or near misses most of the time is myself. I still think about that cat who died because of my mistake. I still think about her, Ola. Still remember her name. And this is probably about 10 years ago that happened. We should remember that doctors, we are human beings, and making errors is inevitable. And in fact, Alexander Pope says to err is human. When mistakes happen, we have to think about us as well and to have compassion for ourselves. So let's adopt a wider context. What does it mean? Yes, a patient died because of my mistake, but I've been a passionate general practitioner for 11 years. I think I helped thousands of pets. And also, I am telling you, all of you, my mistakes, so that they will not happen to you. So I'm trying, to teach every student I met, every new grad, I always teach them my mistakes, to make them better vets than myself. And this is a lot of good that is coming out from my mistakes. And let's remember, it is okay to feel guilty, perfectly normal, but it is not okay to feel ashamed. So sometimes I remember even from that mistake, for days and days and days, probably for months, I was embarrassed to go into the practice because I was thinking that my boss would have thought of me that I was an idiot, okay, because I overdosed that meloxicam. When actually my boss loved me, we are still in touch, we are WhatsApping each other. So it's not okay to feel ashamed, because guilt is, I made a mistake. Okay, guilt is normal. Let's experience guilt for 1 day or 2 days, reflect on it, but it's not good, it's not normal to be ashamed, like we are not bad vet. It's not okay to think I am a bad vet. It's okay to think I made this mistake, I learn from it, but that doesn't imply that you are a bad vet. Guilt is a reasonable emotion and it's okay, but shame is unproductive, unhelpful, it doesn't serve you any good. and leads to disconnection. And also, let's remember, I'm very passionate about this as well, that there is more to life than vet med. And for the first few years of practice, but also perhaps sometimes now, when I introduce myself to anyone new, one of the first things I say is that I am a vet, because we love our job and we very much identify into our job. But now I turned 40 2 weeks ago, and now I also say that I love hiking, I love Nepal, I love hiking in the Himalayas, I love dogs, I love horses. We are more than veterinarians. So let's put limits on the magnitude of the situation. So, for example, most of the mistakes we've seen in one of the first slides, they actually end up in nothing. So the patient is not harmed. So let's think this patient did not die, or all those other patients I helped were not impacted. And also, let's remember, good enough is indeed good enough. So we have to strive for excellence, but do not strive for perfection, because we are not robots, is impossible not to make mistakes. Let's remember, we do more than just sell patients, and we are more than just vets. For example, very good way to zoom out from that situation is to think, what impact will this mistake have next week? Maybe still something, maybe because there is a complaint going on, who knows? But what impact will this mistake have next year? None. In 5 years' time, none. And finally, mistakes are an opportunity to reflect, to grow, to become better vets. How? I hope in your practices you do morbidity and mortality rounds. If you don't do them, be the one who says to your bosses, why don't we do that over a pizza tonight or in a couple of days when a mistake happens? Morbidity and mortality rounds are meetings where the vet team, but with reception as well, with nurses, they discuss a complication or a death or a near miss, and they brainstorm about how to do better or to avoid similar mistakes in the future. Ask for feedback from your senior vets, and very important, promote a psychological safety culture at work. What does it mean? You should work in a place where it's okay, it's normal to share mistakes or near misses without any judgment. If you are not in that place, try to change the culture for a very short time. If you see that there is no way to change the culture, find another job. There are plenty of vet jobs. Encourage open communication, skill building, discuss the emotional impact of the incident. My boss was great with me when I made that terrible mistake with Ola, the cat. It was great. I still remember him for that. And we remember him for life because of how he made me feel so much better with his help. Listening attitude and approach mistakes as teaching opportunities. I'm doing that all the time with all of you. I'm super happy to do that. And let's remember very last message. That nurse, a couple of days ago, if I wasn't listening to my nurse who was saying, look, Cristina, I can see something greenish in this ear when I thought it was an otitis. If I wasn't considering my nurse, of course, the same expert as I am, I would have sent home that dog with eardrops with the grass seeds in his ear. So it doesn't matter the level of experience you have, speak up, always speak up, and making it acceptable for anyone to say something is wrong. I'm not sure what it is, but I need your help here now. Or I think this, That's an effective mechanism to ensure safety, to avoid mistakes, if they happen, to learn from them. So very important message. Always speak up and find a workplace where you are allowed to do that. Thank you. I hope you enjoyed. And I saw lots of messages in the chat. I'm going to read them now because I didn't have the time. Somebody
It's
said
okay.
happy birthday. Thank you so much.
I love the picture of the cat.
Oh, you like it?
Yes.
Yeah, I made a huge mistake.
Yes.
But look, Andrea, so there is a reason why I put these memes. Believe it or not, so I am quite a nerd and I love reading papers. And a paper came out recently, I swear, about how memes are effective in teaching Gen Z people or something like that. So
this is why you use them. Yeah, and well, yeah, it makes you remember things. So
it's evidence-based, you see.
Exactly. Exactly. All right, guys, before we go on to the chat, just so you guys, if you are in the UK, I don't know if we actually have a lot of people in the UK. I think we have a lot of international people today.
Yeah, good.
If you are in the UK, you can have your QR code for your OneCPD app. I have a little question for your reflection,
Yes,
which
please.
is, how do you think this knowledge is going to help you when you make your next mistake? Because you are going to make a mistake. Like this is, if you go through the chat, a lot of that is actually me saying I've done a lot of stuff. I also left here the email, which is not the one I showed you before, Andrea at univetsglobal.com, but it's info@univetsglobal.com. I think this one goes straight to Carolina, my colleague. So if you want a certificate of participation, send us an email to that address and we'll get it done. I'm not promising you it'll be done next week because next week we have a full week of neutering. So we are going to be really, really, really busy. But we will slowly get on top of all of that as well. Now for the chat, what we were trying to see and what we saw there's not a lot of questions, I think.
There are lots of nice comments though, because I'm going to, I'm reading through them.
Exactly, and lots of experience.
But one of them, in Constantine said, in the UK, if you make a mistake as a new grad in the first 6 months, which is the probation period, he will say that, oh, it's fine, but secretly will hold the grudge. I don't know. Sometimes secretly we ourselves, feel that shame. I was saying in the last slides. If you feel my comment about this, I feel to say, if you feel that you are in a workplace where, safety culture is not embedded, so the fact of, being transparent about mistakes, doing, morbidity and mortality, well, I'm sorry to say, but as I suggested you before, look for another job. What do you, Andrea, think?
Yeah, I think you need to be in a place where you're not going to feel guilty. You won't feel guilty about making the mistake, because if that happens, you're more likely to hide it. And now you are in trouble.
Exactly.
If you hide it and someone finds out about that, you are in a lot more trouble because everyone is going to be mad and you are to blame on that.
Exactly.
So, I think that question is, it's a very common feeling we have when we go from a different country to the UK, because everything is a little bit different from other countries.
I was quite shocked because some of my colleagues, when mistakes or near misses happen, for example, even just patients that during anesthesia, they have an hypotensive episode or, they have a very bad recovery from anesthesia. Well, I found some of my Italian colleagues tend to hide this from the client. Mistake. Yeah. We should always, be transparent. I think you are never wrong by being transparent, but this is in life in general, in any human relationship. Transparent communication is always the best thing. Sometimes it's hard. That's why communication is something that we need to study as well, I think. And webinar like this one or similar ones, I think are helpful because they make you start thinking about it in the same way you think about other clinical skills, isn't it? I think
exactly.
Communication skills are unfortunately taught very little in Europe, very, very little in uni, or none. Like in Italy, basically nothing. When I was in uni 10 years ago, nothing. In the UK, they are way more taught also in the university curricula because, guys, 95% of our job is communicating with people, being them the clients or the team, like the nurses, which is a whole other, subject, like team communication between vets, referring vets, referral, nurses, reception, and so on. So super important to be able to handle difficult conversations.
Yeah, I think definitely the environment in which you are in, it's very different from country to country. And that's more on my background of what I've done, because it was very, very common that we had these issues with communication with vets that are coming to different countries. So I know that I used to work with vets moving to the UK, but I am positive that if it was the other way around, the UK vet moving to Italy or to Portugal, they would have a different struggle, but they would also have that struggle because the communication is so much different. So, and if you're not adapted to that, that's what's going to fail. It's not the clinical knowledge that normally fails. It's the communication between team members a lot of times. So countries that don't have nurses or techs, the vets are usually very suspicious about working with nurses or techs. And in other countries where there are nurses and techs, the vets resent having to do that job. It's like, I shouldn't be taking blood from this dog. I have other things to do. I have a surgery to do. So, and it's about the personalities and the general cultures as well. And this is why I think it's useful to talk about this, because the basis of psychology in humans is the same though. So we are going to behave
absolutely
with emotional things like this. It's going to be everyone is going to pass through that.
For example, to de-escalate situations are the same, because as you say, the feeling of anger, of frustration, stress, anxiety are the same for any ethnicity of humans.
Exactly. I think it is always much easier to be transparent and humble, I think, because even if we are trying to be perfect, it's not going to happen, and we are going to make mistakes. And I said here, I've done surgery on the same cat twice, looking for the ovaries. And I was with students. I was teaching students, and we had a lot of cats to do. And we had this cat that was on the table. We're looking for the ovaries. This cat is not having a good anesthesia. I'm worried about the anesthesia. The student is looking for these ovaries in the uterus for a long time. I'm telling them, look, if we don't find it, we are gonna stop. We're gonna wake this kitten up. We're gonna do it tomorrow. We did it the same again the next day tomorrow. Anesthesia was brilliant on the second day, and I gloved in, went in with the students searching for this, and we're like, I'm not finding it. Look, it has to be here. It has to be here. And then 30 minutes into surgery, 30 minutes already we're looking for. I thought to myself, okay, I wasn't on the prep for this cat yesterday or today. Should we just check if it's a girl? And it wasn't. It was a boy. So of course then we stitched it up. We did the castration. We woke up the kitten. It was fine. This was easy to explain because this was a colony cat from the kennels that we work with. So there was no pressure here. I just called them and I said, look, the anesthesia today was great, but it wasn't a girl, it was a boy. So it's got a wound on the tummy.
Much more difficult to explain that to a client.
With the owners, exactly.
Something like this happened, I would say, almost to any vet, senior vet I know of. Like
100%.
So frequently, it's crazy.
You know what? I can tell you the story when I was assisting the vet that is responsible for the council kennels, and she also had a cat to do that wasn't very well, and she was in surgery, and she was also like searching and searching and searching, and 15 minutes after, she's like, it has to be here. Look, it has to be here. Is it a boy or a girl? And she checked it was a boy. So a vet that is doing it every single day.
Literally, yeah, yeah.
She still
So
had that.
something good when dealing with something like this, which is bad, but is to make the owner focus on their here and now. So you explain the mistake, but you say that the cat is going to be fine. You give them longer analgesia because obviously you open the abdomen instead of just opening the scrotum. And then something useful is also to say from now on, as this has happened in our practice, before inducing the general anesthesia or as the general anesthesia is induced, two people will check for the sex of the animal before going on, something like that. So showing the client that we are, from this mistake, an implementation is made to avoid similar mistake in the future. Can I pick your brain, Andrea? Because Konstantin wrote something else very interesting in the chat, explaining adverse vaccination reaction, for example, injection-induced, sarcoma in cats. Not easy to explain, especially because 99% of cats are fine, obviously, with the infection.
Mm-hmm.
Yeah, not easy, not easy. I generally, something you can do, Constantine, is that showing them data, like obviously, because the injection site sarcoma, now I don't know this percentage, but as you say, is quite low. Obviously, the benefits of having the vaccination, so avoid rhinotracheitis, calicivirus, herpes virus, panleukopenia, or leukemia, if you do the leukemia vaccination as well, is obviously, the benefit is obviously much higher than that risk.
Yeah.
And again, when we are dealing with this sort of situation, I think the best technique is to make the owner focusing on the here and now. So what we are going to do now to help their pet, being better despite what happened. I think this is the technique. And as I said, most of the times, all these difficult complications are bigger in our head than what they actually are. Because let's remember, clients know nothing about vet med. We have the degree in vet med. Clients know nothing at all. So they are not judging our clinical expertise because they have none. They are more judging the way we make them feel about what happened. So the way we are understanding with them, we are empathetic with them, we make them feel heard, as I said at the beginning. But seriously, these seem, sometimes they seem very, how can I say, basic, advice, but they really count. Like the way we lead communication is sometimes, unfortunately, more important than our clinical skills, unfortunately.
Yes, it is. And I'm sure, I don't know if you have this or not, but we definitely have this in Portugal, where we have that vet that is really good with communication, so they convince the others about everything.
Antibiotic and dexamethasone, and they are loved by clients.
Exactly. And they can diagnose a splenic mass from abdominal palpation and all of that, and everyone loves them. And then we get the cases that are really sick, but the owner is like super defensive, and that other vet is amazing. And that's because they are good at communicating and convincing the owners that what they are doing is the correct thing to do. And that's, unfortunately, it's one of those where that professional is loved by a lot of clients, obviously. And we vets, we have to like really bite our tongue when we are seeing those patients. And now we have to convince this person that it's not a splenic mass and we need an ultrasound or a CT scan, because we don't think it's a mass, but the other vet said it's a mass. So it's
Yeah,
unfortunately.
I can picture a couple of vets as you speak, in my head. But yeah,
I think
but
every
from
area
them,
has one.
you know what, Andrea, though, from them, we should see how they talk and how they deal with clients, be sponges and absorb those, techniques.
Yeah.
And then we become the best vets in the world, because when you are good, because you study, you improve yourself clinically, but also you have this human touch, because our job is a people-y job, unfortunately.
Yes.
So when you manage to add that human touch, and it doesn't matter if you are extrovert as a nature, like every one of us can learn communication skills. Like you don't have to love people to learn communication skills.
Yeah.
So, once that you learn those as well, then you become the best one.
Yep. And I think it's important. I think we can probably finish this with a nice and interesting principle, which is just like you learn how to be a vet, you can learn how to be a communicator.
Totally.
So
yeah.
Just like you learn how to display, you can learn how to talk to people. Those are skills that you can learn. There's training for that. You can develop that. You can practice that. And actually, it is much, much easier to improve them because you are practicing them on a very constant basis. With every consult, it's a new training opportunity. It's much easier to learn how to do, how to improve your communication than it is to learn how to do a spay, for instance, because it's going to take you two intensive weeks of spaying to learn how to do a spay on your own, maybe, but you can do 20 consults in a day instead of 20 spays in,
This is so true. So
2
true.
months.
So when you see maybe one of your senior vet being more efficient and at communicating with people and people love them, try to shadow them, on some consults and pick, those little tips and tricks they use.
Yeah, I'm pretty sure as well. This is one of the workshops that you organize, right? About communication
We
skills.
do.
And,
yeah, but it's me talking, so maybe they are already fed up with one night, with the night. But yeah.
Yeah, but I think it's really important, and learning these communication skills also helps you dealing with yourself, I think.
Yeah, it's true. And also, I mean, communication, we use it every day, not only at work, as not just vets, but with relationship, family, friends, and so on. But at work it helps massively. I started studying communication, indeed, because I was a foreigner vet in the UK. So because of the language barrier that was already present, I found out that studying communication helped me, having a very good career in the UK and here. So, it helps.
Yeah, exactly. So I think we don't really have questions. This is a much more engaging topic, I think, but I think we covered a lot. I think we left some good lessons here. I suggested that every M&M round should also have M&Ms involved, like real M&Ms. So, but Constantino wants a pastel nut instead, but okay. We can do that in Portugal. We can do it. I think this has been a really, really useful conversation for everyone. I am very happy that we actually had quite a lot of attendance. It was we did quite a lot, very similar to what we have on our webinars. Anyone, if you are here and you didn't get the beginning or the end, or you want to review anything, we do have this recorded. It'll be on the website at some point when we have time to upload it. It's going to be very busy, 2 weeks actually. So forgive us if we're going to be a little bit late with this. But we are going to have it on the website, and we'll try to have it on the YouTube channel as well. We'll give you the links to Christina's and Hilary's page, so you can check them out as well. And obviously, I'm sure that you guys are happy if I share the email, your contact email with everyone.
Yeah, absolutely. Yeah, absolutely. If anyone wants to reach out to me, ask advice about maybe difficult conversation or anything really in general practice, feel free to do so. Yeah, super happy to be contacted.
Thank you so much, Cristina, for this. It was amazing. We need to do something else. And thank you everyone who has joined us tonight. We hope to see you on the next webinar next month. And we hope that this was useful for you, and that Cristina has a great birthday. Thank you so very much, everyone.
Thank you, everyone. Bye.